Hello and welcome to Increasing Patient Activation Through Health Coaching. My name is Amanda Gabarda, and I will be your facilitator today. I am very excited about this topic because as a health coach myself, I recognize the power that activation can have in empowering patients to improve their health and well-being. As we get started with our presentation today, I thought it might be helpful to share just a little bit more about me and my background. I'm currently the Senior Director of Clinical Training and Education at UPMC Health Plan. My education includes a bachelor's and a master's degree in exercise science, a master's degree in public health, and a doctorate in education. I'm also a certified health education specialist, a national board certified health and wellness coach, and a member of the Motivational Interviewing network of trainers. I started my career in health and wellness coaching about 12 years ago as a health coach. From there, I've held many other roles, including supervisor and manager of on-site health coaching teams, senior manager of clinical training and quality assurance, and the director of clinical training and development. I'm really passionate about health and wellness coaching, and I'm excited to share some of my knowledge and expertise with you in this presentation today. In our time together today, we will describe patient engagement and activation and its importance in health coaching, identify health behavior change skills to support lasting change, and illustrate those skills in action through a final case study. Let's first start with patient engagement. Patient engagement is recognizing and understanding the importance of taking an active role in one's health and healthcare. It's also having the knowledge, skills, and confidence to manage one's health. And then finally, it's using that knowledge, skills, and confidence to engage in health promoting behaviors to achieve the greatest benefit. In the traditional medical model of care, the one that our healthcare system is moving away from, patients are told what to do and how to follow their treatment plan. In the patient-centered model for care, patients are activated and engaged in their lifestyle and chronic condition management. They play an active role and they take charge in their health and their well-being. One theory particularly valuable in our work is patient activation. In the traditional medical approach, we start at the top of this triangle with knowledge and skills. But where coaching is different is we start at the bottom or the base of the triangle. We help our patients to be empowered to take charge of their own health. We help them to gain confidence, and then we support their knowledge and skills. Knowledge and skills are important, but first a patient needs to feel empowered to take charge of their health. And then they need the self-efficacy or confidence that they can make these changes and manage their healthcare long term. We don't have the resources in healthcare to give every patient a fish a day. We really need to be able to teach our patients how to fish, how to problem solve, and how to navigate for themselves too. And to that end, we have to make sure that we've chosen a health coaching approach that's going to be effective, one that's going to be efficient and that people can really master and use. And you have already received training in motivational interviewing as your foundational health coaching approach. This is the communication approach that's very congruent with lots of other models and theories, and it really is our foundation. Many of you have already had training, and we're going to be going beyond motivational interviewing today. Also, as a note, if you have not had an opportunity to attend the initial motivational interviewing training available, please contact your practice facilitator to learn more about how to get signed up for free. You really don't want to miss this great opportunity. So to explore more, let's take a deeper dive into exactly what health coaching is. Health coaching is the use of an evidence-based communication approach and strategies to actively engage and guide patients towards a targeted health goal, health behavior change, adherence to their treatment plan, or follow through on a referral. A health coach partners with individuals through the process of behavior change. This is done through support in setting goals, unearthing values, strengths, and motivations, and encouraging the development of sustainable, healthy behaviors and attitudes. Current health coaching literature suggests that it's an effective strategy for promoting health behavior change, including improving nutrition, increasing physical activity, and improving adherence to medications. Health coaching's effectiveness has been demonstrated to reduce health risks, including decreases in body mass and weight loss, positive changes in blood pressure and lipid levels, and decreases in blood glucose and hemoglobin A1C. Moreover, research demonstrates the effectiveness of health and wellness coaching in improving the health status of individuals with chronic conditions, most notably improve self-care regimen compliance. What you're looking at here on this screen is just a quick snapshot of some of the literature. And for those of you who are really interested and want to get under the hood and learn more, I'm happy to talk more about that after this presentation. The coach's role is one of a partner in navigating behavior change and exploring opportunities for growth and development. As facilitators and partners, health and wellness coaches support their patients to achieve self-directed behavior goals consistent with the patient's vision for health and well-being and coupled with treatment plans prescribed by the patient's professional care team. They do this in a number of ways. First, they apply effective communication skills using motivational interviewing to help a patient increase motivation and ownership for making a change. Second, they help patients to develop achievable and measurable goals to monitor success and motivate ongoing behavior change. And third, they also help patients to develop and exploit their strengths to support that successful behavior change. Patients have many needs when it comes to health and well-being. Coaches assist their patients to use their own insight, personal strengths, and resources to set goals, take action steps, and build an envisioned healthy lifestyle. In this way, coaches empower their patients through encouragement, exploration, mobilization of internal strengths, identification of external resources, and through the support and development of self-management strategies for executing sustainable, healthy lifestyle changes. I like to think of a health coach as kind of a jack of all trades when it comes to health and wellness behavior change. At various points during the coaching relationship, you may wear a number of hats when it comes to supporting your patients. And finally, health and wellness coaches train in behavior change theories, motivational strategies, and health education promotion theory. They use these to support the patient in creating and sustaining change for improved health and well-being. For anyone that's really interested in this topic, I'm happy to connect offline and share more about any of these models and theories and how they fit within health and wellness coaching. But for now that we have a pretty stable foundation, let's move into behavior change skills, or the nuts and the bolts of what we're really going to cover today. In this next section, and the second half of the presentation, we're going to explore behavior change skills and how they can help and support coaches in engaging and activating patients on their path to better health and wellness. Here is a list of the behavior change skills that we're going to explore more together today. The first is self-efficacy and personal agency. Self-efficacy is the belief that one has the capacity to initiate and sustain desired behavior. In health coaching, self-efficacy refers to a patient's confidence in the ability to manage a chronic condition or change a health habit. A goal of coaching is for our patients to achieve and sustain the goals that brought them into coaching and feel confident in their ability to attain new ones in the future, navigating health challenges as they arise. Coaching can support this in a number of ways. Strategies include evoking and fostering statements that support expressing confidence for or meeting a goal, evoking and fostering confidence for overcoming barriers, and acknowledgement of accomplishments or action steps towards goals. Research has shown that self-efficacy is one of the most important outcomes of coaching in combination with improvements in self-image and lasting mindset and behavior change. Self-efficacy can exert a powerful influence on how successful we are in achieving important health or life goals, which is why this foundation is so important. Personal agency can be defined as the understanding of oneself as an agent who is capable of having an influence over their own motives, behavior, and possibilities. Agency is akin to constructs such as self-efficacy, locus of control, autonomy, implicit beliefs, and self-esteem. But the closest concept to agency is one's belief in free will. In the context of behavior change science, it is the belief that what I do matters and has an influence on my own health. For example, if I walk daily, I can help my blood pressure to go down. Coaching strategies for personal agency include eliciting strengths from past successes, providing affirmations even when your patient is stuck or has not been successful, and supporting envisioning and how life might be different if your patient accomplished the behavior change target at hand. Next, we will explore self-monitoring. As a health coach, assisting our patients with behavior change can be particularly challenging because our interaction is often limited to weekly or monthly sessions or check-ins. Because many health behaviors need to be targeted outside of these meetings, finding ways to track progress is also necessary to successfully provide our patients with appropriate feedback and direction. Thus, supporting them to self-monitor can be an effective strategy for behavior change. Self-monitoring is a core component of many behavioral treatments and health coaching programs. Behavioral self-monitoring is part of the social cognitive theory's self-regulatory mechanism, leading to personal agency associated with goal achievement. Self-regulation theories have suggested that behavior change occurs by self-monitoring a behavior or a behavioral outcome, and then by comparing progress with a target or past performance over time. This process allows the patient to have heightened awareness of their current behaviors and corresponding triggers while also increasing self-efficacy and accountability. There are many ways to support patients in using self-monitoring as a behavioral skill. Strategies include asking the patient the benefits of tracking and how that might help to support their health behavior change goal, exploring the impacts of tracking and how knowing certain data points might support their overall goal, evoking the insights gained from tracking and what they might have learned or what was surprising to them, and setting goals using tracking as the foundation if your patient is willing. Next, we will explore goal setting. Within healthcare, it's only been in recent decades that goal setting has been examined more thoroughly and used as a method to evoke positive behavior change. Edmund Locke of the University of Maryland and Gary Latham from the University of Toronto are industrial organization psychologists who have pioneered the scientific investigation of goal setting, especially when used in the context of wellness. Their 40-plus years of experience studying goal setting and the integration into more than 400 studies have informed a general model of goal setting theory. This theory states that a person's values drive his or her emotions and desires. This image of how a person envisions themselves informs their intention or goals. Goals then inspire behavior change or affect performance through 4 mechanisms. They include directed attention, mobilized effort, persistence, and strategy. Let's dig a little deeper into these mechanisms. Goals direct effort and attention towards activities that are goal relevant and away from those that are irrelevant. Goals serve as an energizing capacity, and that higher set goals lead to greater energy expenditure and better performance than lower set goals. Goals impact persistence, so harder goals can prolong effort. And finally, goals can affect actions indirectly through the discovery and/or application of task-related strategies and knowledge. In health behavior change, we set what are called SMART goals. And I know that many of you are probably familiar with this because of your motivational interviewing training and the planning phase, so we'll move quickly through this section. The first is a goal specific? Does it include the what, when, who, how, etc.? Is it measurable? Does it say how much, how many, how often, and contain numbers to check progress? Is it appropriate? Do the patients feel good about trying to reach the goal, and will it lead to the long-term goal? Is it realistic? Is it too easy or too hard? And do the patients have the resources that they need to reach this goal? And finally, is it timely? Does it have a clear start and end date? Let's explore problem solving next. Sooner or later, on the path to behavior change, your patients will encounter problems or hurdles that are getting in the way of their success. As a coach, you can support them to overcome these hurdles by using problem solving. Problem solving is a behavioral process that makes available a variety of response alternatives for dealing with a problematic situation and increasing the probability of selecting the most effective response among those alternatives. One of the best ways that you can plan for and overcome hurdles is to use a 6-step process for solving problems. The coach approaches the problem-solving process without any assumptions about the patient or their situation, and they remain incredibly curious and non-judgmental as details unfold. This is because you don't want to dictate solutions or sway your patients in any way towards one action. If your patient is truly stuck, one approach that you can also use is to support them by giving an idea or two for every few that say your patient has. This can help to generate possible solutions, but ensure that you're not dictating the direction of the possibilities. So as you can see here on the screen, the 6 steps are to 1, identify the problem and be as specific as you can. Partner with your patient to brainstorm possible solutions. Evaluate those solutions and then make a choice on one. Based on the solution chosen, make an action plan that incorporates this solution. Go ahead and do it and make the change. And then assess the results and see what happened. Was the patient successful? What did they learn? And then how might they make changes moving forward? There are many ways to support your patients in solving problems. A few strategies include helping your patient to problem solve for a barrier, engage in trial and error, or even recommit after trial and error. Approaching the problem-solving process without any assumptions about the patient or the patient's situation, and remaining incredibly curious and non-judgmental as details unfold. Not dictating solutions or swaying your patient in any one direction or action during your problem-solving process. And finally, celebrating success and supporting trying another solution. We know that not all problems are solved the very first time that you implement something new. So celebrating the success and the learnings and then helping to develop a new action plan can be critical in the problem-solving process. Next, we have self-awareness. Self-awareness is the practice of observing and questioning oneself in order to form an understanding of behaviors, patterns, strengths, and blind spots. Having this skill can help a patient to think about their lifestyle objectively and allow them to identify their emotions, be in tune with their body, be perceptive to their behavioral patterns, and value their personal strengths. Those with self-awareness are best able to find the determination and perseverance to overcome obstacles. However, self-awareness takes practice and is a skill that many can struggle with. In health coaching, the coach is deliberate about getting curious in an effort to elicit such insights from the patients themselves. When evoking self-awareness from your patients, the coach can help the patient to discover new or existing thoughts, beliefs, perspectives, emotions, etc., that can strengthen or hinder their ability to make effective action towards their stated goals. They can communicate broader perspectives to the patient that inspire new patient viewpoints and possibilities by evoking inquiry for greater understanding, awareness, perception of self and what's possible, and clarity. And they can assist in developing a plan for assertive and self-talk as necessary. And finally, we have social support. Based on the original stress and social support theory, researchers from a variety of disciplines have studied the ways in which social support affects an individual's physical and mental health. Seminal and current works have documented the protective effects of social support across a number of health behavior areas. Social support and social networks are concepts that describe the structure, processes, and functions of social relationships. Social networks can be seen as a web of social relationships that surround individuals. While the lines are blurred, several theories and a bounty of research on social relationships indicate a significant bidirectional relationship between social support and health. Specifically, increased longevity, higher self-esteem, empathy, and faster disease recovery. The ability to properly leverage and use social support in coaching conversations is another vital part of the coaching process. So this means that the coach is a support and empowers their patient to seek support. The coach also provides ongoing support for and champions new behaviors and actions, including those that involve risk-taking or even fear of failure. The coach also discusses social support with their patient and thoroughly explores and details the areas of support outside the coaching relationship. The coach can also explore other avenues for accountability. This includes things like visual cues, self-monitoring, peer support groups, etc. Let's put this all together into a brief case study. This case example is a snippet of a call with a health coach. Debbie, the patient, is interested in losing weight, and her coach is supporting her using some of the behavior change skills at a high level. This session is brief, and it's not perfect, but can give you an idea of combining motivational interviewing skills with the behavior change skills for the health coaching approach. Pay attention to how the coach was able to use some of the skills we discussed in this short snippet, and we'll debrief after.
Debbie, you mentioned that you would like help losing weight. Would you mind telling me a little bit more about that?
Sure, I have been trying to lose weight on my own now for a while, but I can't seem to get anywhere. I feel frustrated because I really want to be successful.
You've been putting in the effort and have a vision of success, but feel like something is missing to make that happen.
Exactly, I just don't know what I'm doing wrong. And I have a really busy schedule, so it's pretty hard to keep track of what is happening with my diet. So, most of the time, I just get fed up.
Frustration and feeling a little lost in terms of what is actually happening within your diet seems to be a big component of this for you.
Yes. I guess that's true because I start out with good intentions, but then before I know it, my whole workday has gone by and I've either skipped some meals or go and get the most convenient lunch option without putting much thought into it. Then, of course, I get frustrated when I don't lose weight that week and my motivation goes down. It's definitely a cycle, and I'm not sure what to do to get out of it.
You are definitely not alone in your frustration, Debbie. Weight loss isn't easy. but I'm here to support you. You sound stuck. If it's okay with you, perhaps we can talk about some strategies from our weight management program that have helped others in this area.
Yes, absolutely.
Before I dive into explaining, what do you know already about keeping a food journal or tracking your calories?
I have heard of that and my sister used to do it, but I've never given it a real try.
Does that sound like something you'd like to hear more about?
Yes, I think so.
Okay, well, keeping a food journal is something we often encourage members who are interested in losing weight to do. It can help someone feel like they have a clear budget for the day in terms of calories, and it also provides a lot of insight in terms of what's going well in the diet, and maybe where to focus in on for making changes. How does this sound so far?
I would be up for trying that. I definitely think having more structure for the day would be helpful. Although I'd worry that it could become tedious, I don't have a lot of spare time, especially during work.
You like the idea of tracking and could see the benefit. However, in order for it to work for you, it would have to be something that didn't take up too much time.
Yes, I mean, if it was going to help me, I could find some time to do it, I'm sure.
One nice option to make sure tracking doesn't take up too much time is using a smartphone app and/or website. Would something like this be up your alley?
Absolutely. I always have my iPhone on me.
Wonderful. The nice thing about this option is the apps are generally free, have features like storing your frequently logged foods, figuring out recipes for you, ability to scan barcodes, and more. It really fills in a lot of those tedious gaps. After hearing a little bit about this first option, how are you feeling about tracking?
I definitely think that would make it easier. I really want to try it. I will have my daughter help me with downloading the apps.
You're really thinking about what is going to work best for you and how you can realistically start making this change. That's going to serve you well in the long run. Sounds like your daughter would always be up for helping mom out too. That's great.
Yes, she is always helpful and supportive of me wanting to lose weight.
That's really nice. How else might you see your daughter or someone else supporting you through this?
Well, my daughter and my neighbor have both already offered to go on walks with me in the evening. I just need to take them up on it. That would make exercise a lot more enjoyable for me.
Yes. Isn't it so much better to buddy up and get some social component to the walks? That sounds like it'd go really well once you have the routine established.
Yes, exactly. I really like these ideas of starting to track my food and getting more walks in. Just need that routine like you said.
All right, that sounds good. It may be helpful to think about your desired action steps and how they can become a routine. What do you think would be a realistic goal to start just for this week with your tracking and walks?
I think my goal with eating would be to download the apps, check them out, and start getting a feel for how they work. Maybe I will officially track my full day 3 times this week. I'd also love to set up 2 30-minute walks with my daughter.
All right, so let's take a look and debrief what we saw in this short snippet. Our first area is self-efficacy and personal agency. And in this example, the health coach affirmed progress, efforts towards the goal, and insights throughout this call. So this one was unique in that you saw it really weave throughout the entire snippet. We know that by doing this and using this strengths-based approach, the coach was able to increase the patient's confidence as well as to help support that sense of agency or that belief that their efforts will really make a difference, specific to the area of weight management for this example. Our next one is self-awareness. And for this one, the coach affirmed the patient's efforts and made an observation about where she was with her diet and the challenges that she was facing. And the coach did this in the form of a reflection, and the patient really started talking about skipping meals and getting frustrated with motivation and the cycle that she was describing. This led her to then talk about ideas that she had for making a change, and we were able to get some really good change talk there. Next is self-monitoring. And for this behavior change skill, the coach asked what the patient already knew about self-monitoring and if they wanted to learn more about how others had been using it successfully. And we had an opportunity to really see a person-centered way to ask a patient if they're interested in learning more about an evidence-based strategy without necessarily having to give a recommendation or having that expert hat on and telling them that they should do it. In this case, the patient was interested and the coach was able to share more. Next, we have problem solving. And for problem solving, this was really brief and kind of more high level. So we weren't really able to see the 6 steps in action, but more of an introduction. And in this case, the coach asked if the patient was interested in using an app to track as an option to solve her problem with knowing what she was eating throughout the day. So I can imagine that if there was more time or we were looking specifically at this one skill in a longer call, we would have possibly seen the health coach go through all 6 of those steps. But this is also a really good person-centered way to offer a solution, again, without having that expert hat on and telling that patient what they should do or how they should do it. Next, we have social support, and we know how important social support can be for making a change of any kind. So in this example, the coach who was supporting the patient through the behavior change really asked a great question about who is there to help or support you. And the patient started talking about her neighbor and her daughter, and she also talked about how they help and ways that she might be able to tap into their support for this new goal in the future as well. And then last but not least, we have goal setting. And so in this example, the coach asked the patient what the week's goal might be. And what we really saw here was her kind of shaping it herself into a SMART goal. So something to remember is that as a health coach, you may have to help the patient add in the how, the timeline, and other specifics to make it a SMART goal. And that's okay. And one way that you can do this is by asking really good, curious, open questions in those areas. So, for example, how might you know that you have reached this goal? Or what timeline do you want to accomplish this by? Or how many times this week might you do XYZ? And so asking just those very curious, open questions can really help and support shaping into a SMART goal. And that concludes our presentation for today. I'd like to thank you for your time. And if you do have any questions, you can reach me at the email listed below. Thank you, and I hope you enjoyed this presentation.